So we're going to talk about physical exam today, and that's the most important thing that we do when your cat comes here for a visit to Cats Limited. So we have with us today Linnea, who's one of our veterinary technicians, and we have Seamus, who's going to be our volunteer for the physical exam. So Linnea is going to weigh Seamus to start, and that's the beginning part of his visit, and then we'll start his exam. Okay, so we've got his weight recorded, and I'm going to come around, and when I do the exam, I usually start at the head, and we'll work and examine him from his head to the tip of his tail, and the purpose of that is to check for things that are normal as well as abnormalities that we may want to address for his overall health. So, Seamus, we're going to take a look in your ears, and this is called an otoscope. And it has a light as well as a magnifier, and this is going to help me look all the way down into his ear canal to his eardrum, and I'm looking for any changes as far as infection or evidence of ear mites. And we're going to look in his right ear as well. Seamus, that looks perfect. No changes there. So then we're going to move down to his eyes and use an ophthalmoscope, and this is the same idea. It has a light as well as a magnifying glass. And I'm going to use it to take a look in the back of the eye, specifically at the retina. And I'm checking the blood vessels and the structures back here for any changes. I'll take a look at the left eye as well. And the back of his eyes look great. We're also going to check his response to light, which appears normal, as well as something called the menace response. And when we do this, we're looking to see if the cats are visual. So he's blinking, and that's good. So his eyes look good as well. And I'm going to check his nose for any evidence of discharge or irregular features, and that is fine. And then we're going to take a look in his mouth at his teeth. So I'm going to lift his gums up, and I'm looking, he's got just a little bit of tartar, but we're looking for tartar, we're looking for inflammation of the gums, and we're checking for any broken teeth or diseased teeth. And other than just a little bit of tartar, Seamus's teeth are beautiful. I'm going to open up his mouth and look inside for any changes there. Also take a look under the tongue if we can, and he's a very good patient. So there's no abnormalities there. You're a good boy. And we'll feel under here for his thyroid for any changes in size. And normally in a cat you shouldn't be able to feel the thyroid, and I don't for him. Good boy. So let's take a listen to your chest. So we're listening for a normal heart rate and a normal rhythm. And then we're going to move the stethoscope up and listen to the lungs. Sounds good there, buddy. Good boy. And then I'm going to move back to his belly, and with that we're checking size and shape of the internal organs. So we start up by the rib cage, and we're feeling in the area of the liver, and normally we shouldn't feel the liver in a healthy cat. And I'm going to move back to feel their intestines, and a lot of cats wiggle a little bit with this. It's a bit uncomfortable. And move back to the area where the bladder is, checking for any discomfort in that area, as well as stool in the colon. He feels very good inside. And then we're going to reach up and feel his kidneys. Feels good there, buddy. And then we continue with examining the lymph nodes, and in cats there are lymph nodes around the head area, in front of the shoulders, and underneath the front legs. And I do feel their mammary glands, and boys have mammary glands as well as girls. And they are normal, and we're going to work our way back to the lymph nodes inside the back legs. and behind the knees, and they are great. We're going to check under your tail, Seamus. That looks good. Just looking for any wounds or parasites, specifically tapeworms. Sometimes they can be seen around the anal area. And then I'm going to take a look at his feet and his nails. Good boy. And those look good. Okay, Seamus. And then the last part of his exam is just to feel down the spine, and we're doing this in cats just to make sure they don't have any signs of arthritis or discomfort. A lot of cats as they age will get some stiffness or trouble going up and down stairs or jumping, so he feels good. And then we do try and check the range of motion in the back legs because the hip area as well as the knee can sometimes become stiff. Seamus is a young guy and he's got very good mobility. And we're also checking the kneecaps as well. Some cats have kneecaps in this area that might move a little bit out of place, but he feels good. So he is a healthy young cat, and that is how we do our exams at Cats Limited. And again, it is the most important part of their visit for us to determine if the cats have any changes that we need to address medically.